Many of us suffer from aches and pains in our joints and limbs as we age and our body deteriorates. And many of us, like me, would like to solve these issues non-invasively and with as little downtime as possible. So I took a trip to Tampa to visit Total Regenerative Therapy and Dr. Frank Lanziseri. Stem cells, we hear a lot about that lately. Break it down for us. Exactly what is a stem cell?
So we all started from stem cells, Linda, when we were a fetus developing. Now we're using umbilical cord blood stem cells from a healthy baby born from a healthy mom, and we're using stem cells for autoimmune conditions and osteoarthritic joint conditions now.
How can they help relieve our pains?
So as we're aging, we're losing stem cells. So we all know that when you're injured, healing is encoded in our DNA, right? So if you break a bone, you have a laceration, the body heals because of stem cells. As we're aging, we have fewer. For example, my 7-month-old grandson, 1 in 10,000 of his cells is a stem cell. At my age, 63, 1 in a million.
Oh my goodness.
Yeah, so this is the reason we heal slower with aging. We're losing them. So stem cell therapy helps replenish the cells we're losing to help us heal quicker.
And where do you get these stem cells again?
So these come from donated by a healthy mom who had a healthy baby from a C-section, right? And the labs like to use a C-section because they can be there. They know when the C-section will happen, and they can be there to collect the tissue immediately.
I've had friends that saved their own from giving birth, so
Yes.
You don't have to do that anymore.
You really don't have to do it because you don't have to match. The umbilical cord stem cells are undifferentiated, so anyone can use them. There's no matching. There's no exchange of genetic material. There's no blood matching. So the immune system doesn't reject them. Actually, umbilical cord blood stem cells have been used since the early 70s for bone marrow transplant.
So what conditions can they help?
Osteoarthritis of the knee, osteoarthritis of the hip, shoulder, ankles. And we're also using it for inflammatory conditions associated with autoimmune disease like rheumatoid arthritis, psoriatic arthritis, or inflammatory conditions involving the thyroid, Hashimoto's thyroiditis.
Of course, we're all afraid of pain. Does it hurt? Is
Right.
this surgery?
Right, so there are 2 types of stem cell therapy. There's autologous, where they use your own. That involves surgery. They either use liposuction to get the stem cells from your fat or from your bone marrow, so that's surgery. Or there's umbilical cord. There's no surgery involved at all.
Oh,
no
really?
surgery, less downtime, and it's an easy injection. If it's an autoimmune condition, we'll do an intravenous injection. The nurse practitioner does it. Or if it's a joint problem, it's intra-articular in the joint.
So how much downtime do you have then?
For intravenous, there's no downtime. For a joint problem like the knee, the hips, the ankle, we might restrict some activity for a few weeks afterwards and then increase activity quickly after about a month.
Oh, that sounds amazing. What difference do you see in the person after they've had the stem cell?
Well, I'll give you an example. We had a 90-year-old woman who came in 4 weeks ago. Her knees were terrible. She could not get up from a chair anymore. She wasn't able to play with her great-grandchildren, and her goal is to go to a wedding this summer where she can walk, not be in a wheelchair. After 4 weeks, her pain is gone. She's able to get up out of a chair, no pain. And her daughter filmed her coming up our handicap ramp quicker than ever. The first time she came to the office, it took her forever to get up that ramp. The video shows she's walking right up. That's after 4 weeks in a 90-year-old. So we see tremendous results.
How many injections do you have to have?
Only one for her.
Wow.
Only one treatment.
Oh my goodness.
Right.
What are they doing in our body?
So they get in your body and they start to divide, right? So these stem cells will double every 18 to 28 hours. And they divide about 65 times. So over about a 3-month, 4-month period of time, they've doubled. And then some of them develop into different types of tissue like cartilage, tendons, ligaments. Some of them go dormant to be used when needed. And some of them decrease inflammation. They're very, very powerful anti-inflammatories, more powerful than most drugs.
Is this the sort of thing we'll learn at the seminar? You've got a seminar coming
Yes.
up. Where is that going to be?
We're having that at the University Park Country Club tomorrow, and it's a luncheon. And if you go to our website, betterstemcells.com, you can register there.
And learn all this information for yourself.
They will not leave with questions unanswered.
Well, I have learned so much from you, and it's so exciting when I look at my knees these days. Thank you so much.
Thank you, Linda.
And again about that seminar, you can learn more at the Stem Cell Seminar and Luncheon. It's tomorrow, September 12th at 12:30 at the University Park Country Club. For more information and to reserve your spot, visit betterstemcells.com.